Good morning to Bipolar Back Room. I'm still having troubles with my camera, so I figured I'd make the video early, and you can look at it whatever time. Topic is unipolar and bipolar 1. They use Roman numerals 1. So, present knowledge suggests that the likelihood that patients so identify as unipolar have had unreported depressions or have not followed long enough to rule out future depressions. And in depression, they manifest themselves primarily as episodes of increased sleep, decreased energy, and slow thinking. So they think it's now just a variant of bipolar, but I want to present all of you to everything. The NIMH, which I should know those initials, but I'll check and get them for you. Collaborative Program on the Psychobiology of Depression Clinical Studies followed 27 patients from a pool of 163 bipolar 1 patients initially admitted with a diagnosis of unipolar mania. That's from Solomon et al. That means there are other people that wrote with him or her. And they found that 7 of them suffered no episodes of major depression during the first 15 to 20 year follow-up. That is, unipolar represented a 4% of the total bipolar sample. And by contrast, the unipolar mania accounted for 16% of patients in their lithium clinic in Turkey. Now, lithium is one of the medicines. I may have an episode where I mention medicines, but I'm not a doctor, I'm not a counselor, and I'm not a pharmacist. But it may have some good knowledge of having all the medicines and having what they're aimed at. So you are a very savvy patient and can go in discussing what you know might work well. Some of them have a result of gaining weight and things as that, nausea, stomach trouble. So you can go in as an educated patient, and I think we should all be that for physical and mental illnesses. And here is what I found when I looked up bipolar. A proposed definition of bipolar spectrum disorder. Like there's an autism spectrum, and this book by Goodwin and K. Jameson Redfield, that's Manic Depressive Illness, Bipolar Disorders, and Recurrent Depression, Volume 1. I'll show it again another time. I have lifted it up before. At least one major depressive episode, no spontaneous hypomanic or manic episodes, a family history of bipolar disorder in a first-degree relative. That would be a mother, a father, maybe a brother or sister. I'll have to look that up again, but certainly a mother and a father. Antidepressant-induced mania or hypomania. That means they give you an antidepressant medicine that brings you back to baseline and could shoot you into a mania. That's my understanding beyond what's written here. Hypothalamic personality at baseline and not depressed state, recurrent major depressive disorder, brief major depressive disorders, atypical depressive disorders, increased sleep or appetite, psychotic major depressive disorders. Major depressive disorders are a different diagnosis than just regular depression. I've gone over this before. You lose a close person, a family person, or a friend. You have a divorce. You are depressed and you cry and it lasts for a while. Most likely that's not chronic depression, which would be major depressive disorder known as MDD. But they still might put you on an antidepressant depending on how long it lasts. But you are a fortunate person, because one of the 16 antidepressants that they have in their toolbox right now will probably work for you and bring you out of that kind of depression a little sooner than you might go through it yourself. It might be your own choice, and you might have to say to the doctor, you know, this feels so bad. Is there anything you can do for me right away? But certainly I'd mention it to your general practitioner or your internist. That's the regular doctor that should tie in with all your other doctors. At my age, I have one of them. Sorry, I need water early in the morning. Early age at onset of major depressive episode before age 25. Antidepressant tolerance, wear off, acute but not psychophilic response. Lack of response, antidepressant treatment trials. Oh, postpartum depression. This is what I felt bad about finding out. And I should have known it just being a woman. We have cycles. Let's just call them cycles. And after you have a baby, you can be in a special depressive mood. Doesn't make a whole lot of sense, but it happens. And people are like, why aren't I excited at the baby? Why aren't I thrilled about baby clothes? Blah, 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 blah. And that might be postpartum depression, which ties in with a lot of hormones with women. I never wanted to think, and I don't know why, I just wasn't wishing women have this, but we are cyclic, monthly cyclic, and I don't want to go into details because that's not what this is about. Also, because there wasn't a lot of talk, I don't know how many years ago, about menopause. And now it seems we're okay with talking about menopause. And perimenopause, which maybe I didn't find out, I don't know, 15 years ago. Now, there are a lot of women that want to speak to this on TV, actresses, talk show hosts. And I think it's good because it gets you started. I mean, it is something. It is something. You can have hot flashes just like you have in menopause. And menopause and perimenopause would be subjects for a whole nother channel. So I won't go too much into it. But some people that their bipolar illness does not show, it can show in the cyclic hormone changes in menopause. That can be maybe your initial experience with mental illness or things that look like mental illness. So if you're in that age bracket, you might want to, you might want to keep up with that. You might want the doctor that takes care of that, which is not me, and that's not this bipolar back room. I don't know what they'd call their channel. So that's enough of that. But I think it's good that we're talking more about it, because women used to go through it and not totally understand what it's about. I'm not even going to give you most the more of the symptoms, but hot flashes can happen at night. You can really feel hot at night, and then if you have a partner or a spouse, they probably don't understand. And even if you tell them what it is, they still might not understand. Maybe your partner or your husband will understand, and that will be great. The British writer Alan Gardner, 1997, pages 208 to 209, portrayed the deadening and the horror of the beginning of his manic depression breakdown. So this is an example of a person and what they say, which I think is so cool and helpful. The next thing I remember is that I was standing in the kitchen in the sunlight, looking over a green valley with brook and trees, and the light was going out. I could see but as if through a dark filter, and my solar plexus was numb. I said numb before. Some contraption, a piece of mechanical junk left by one of the children, told me to pick it up. It was cylindrical and spiky and had a small crane handle. I turned the handle. It was the guts of a cheap musical box, and it tinkled in its few notes over and over and over again, and I could not stop. With each turn, the light dimmed and the feelings in my solar plexus spread through my body. When it reached my head, I began to cry with terror at the blankness of me and the blankness of the world. Blankness, numb. These are excellent adjectives to try to get into the head of somebody's that having these episodes. All helplessness, cold, and horror comprised me. When the family came home, I was lying on the kitchen settle in a fetal position, without moving or speaking until I went to bed at midnight. Sleep was unconsciousness without rest. Some people have experienced that and have no mental illness. To sleep, but you're not getting the quality of rest you need, or I think it can just be called REM sleep, but the lack of REM sleep. But again, that would be another program, and I don't want to speak from something where I don't have a background. Composer Hugo Wolf's account of depression, quoted in Walker, 1968, page 322. When I suffer from this continuous idleness, I'm quite unable to describe. I would like most to hang myself on the nearest branch of a cherry tree standing in full bloom. This wonderful spring with its secret life and movement troubles me unspeakably. This eternal blue skies lasting for weeks, this continuous sprouting and budding in nature, these coaxing breezes impregnated with spring sunlight and fragrance of flowers, made me frantic. Everywhere this bewildering urge of life, fruitful creation, and only I, although the humblest grass of the fields, once of God's creatures, may not take part in this festival of resurrection. At any rate, not except as a spectator with grief and envy. This is after the quote. The sense of lost energy is of singular importance in understanding the subjective experience of depression. The ebb and flow of life's force or vitality and its painful absence in depression were described by F. Scott Fitzgerald in The Crack Up, 1956, page 74, first published in 1936, a harrowing account of his personal nervous breakdowns. Now, we don't usually use those words anymore, although I think some people do, and I'd have to check if doctors are still using that, because we don't say crazy anymore. We don't say insane. We don't put people in asylums that we did until the discovery was made that this manic and depressive went together, and that it was one illness, and there was lithium, the emergent first drug that was really helpful to many people. And this is F. Scott Fitzgerald. Of all natural forces, vitality is the uncommunicable one. In days when juice came into one as an article without duty, one tried to distribute it, but always without success. To further mix metaphors, vitality never takes. You have it or you haven't it, like health or brown eyes, or honor or a baritone voice. Ye are the salt of the earth, but if the salt has lost its savor, where within shall it be salted? Matthew 5:13. And since this has gone 16 minutes and 48 seconds, I'll keep going on bipolar 1. But this was about unipolar, and certainly getting us started on unipolar 1. Many things, many suggestions. I am not a counselor. I'm not a doctor. I am not many of the types of doctors that I was referring to during this episode. My great advice would be to talk to your GP, your general practitioner, or your internist, which they are probably kind of the same kind of doctor, about what you're going through. They will have some familiarity with it. And then a psychiatrist, a counselor, but significantly, if there's one person in your life, a friend, a relative, part of this net that we're creating, you've got to tell them that this has started with you, especially in the extreme cases of depression. Just tell one person for starters. Don't keep yourself isolated. That is the answer and the beginning for many people who don't want to admit this is part of their life. You need to admit it so that you can get to that baseline, that place where most of the world is, so you can participate in that world and only worry about your episodes, which now episodic circumstances can be rectified with medicine, cognitive behavioral therapy, talk therapy. So don't go without availing yourself of that, but minimally, tell one person, tell one friend, so that someone knows what's going on with you. So, as always, I enjoyed sharing. I went to YouTube, I paid more money, and I'm still not able to get my camera working, but I won't give up. I am not a person that gives up. So, I hope you like this longer than usual, 5 at 5, with whatever time of morning it is, and I'll see you tomorrow, whatever time I video, and I'll keep trying for live at 5, so you should check rather regularly if I manage to fix that. Take care. See you tomorrow.